Hey there, Marshmallow Warriors. Welcome back to Medicare and Marshmallows, the only campfire where the sparks are hot, the cocoa's flowing, and the Medicare stories are roasted to golden perfection. Today, we're flipping the script. We're chatting with a guest who chose Medicare Supplement instead of Medicare Advantage. Same fireside, different flavor. Joining us is Sylvia M., retired librarian, crossword ninja, and Medicare Supplement maestro. Sylvia, welcome to the fire pit.
Thanks, Kem. I brought my marshmallow fork and my list of grievances. And gratitude.
Right on. Okay, Sylvia, let's set the stage. Why Medicare Supplement instead of Medicare Advantage?
Simple. Freedom, darling. Freedom. I wanted to see whatever doctor I wanted, no referrals, no networks. I spent gazillion years following rules in the library. In retirement, I'm allergic to gatekeepers.
I love that. Dewey Decimal System? Fine. Doctor networks? Hard pass.
Exactly. I pay my Part B premium, my Medicare Supplement premium, and that's it. I walk into a doctor's office or hospital with swagger, as the kids say, and I owe basically nothing.
Sounds like that's working really well for you.
I love that I know what to expect. So far, here's what I've racked up at no additional cost. Had a knee x-ray? Covered. Needed stitches after trying to reenact a TikTok dance? Covered. Saw a specialist for my wrist after that same incident? Covered. There's no surprise billing scavenger hunt. I hand them my card, they handle it.
How about traveling across the country?
Yes, I went to visit my niece in Oregon, got bronchitis, walked into an urgent care, flashed my Medicare supplement card like a VIP pass, and boom, they treated me like royalty. I half expected them to give me a robe and slippers.
All right, real talk. What's been challenging?
Oh, honey, the premiums. Medicare Supplement isn't cheap, especially for someone on a fixed income. It's like adopting a very boring, very expensive pet. Doesn't fetch, doesn't cuddle, eats $200 plus a month in premiums, and no extra goodies either. No dental, vision, hearing aids, no prescription drug coverage. I have to DIY all that.
No free gym memberships either, right?
Nope. My gym is my living room and a sassy YouTube instructor named Brad who thinks I can do 30 push-ups in a row.
Now that's funny.
How about cost-sharing experiences? Any shocks?
Honestly, no big shocks yet. That's why I chose Medicare Supplement. I had a colonoscopy, the world's least festive party, and between Medicare and my Medicare Supplement Plan G, my bill was literally $0.
You paid nothing for a back row seat to that adventure?
Oh, I see what you did there. And nope, nada. Worth every unspent penny.
Oh, come on. Can't be all boring. Okay, favorite random anecdote?
Let's see. I tried to explain Medicare Supplement to my neighbor Frank, who's 73 and gets all his Medicare info from Facebook memes. He thought Medicare Supplement was a company that sells orthopedic shoes.
Honestly, I'd buy those shoes. So, Sylvia, if you had to sum up your Medicare Supplement life in 3 words, what would they be?
Predictable, portable, and pricey, at least on a monthly basis.
A perfect marshmallow roast. Thanks for sharing your experiences with us, Sylvia. That's it, folks, on this episode of Medicare and Marshmallows. Until next time, keep your fire lit and your copays low or non-existent.